All right, so we're talking about homework today. And so what we're talking about is the activities that we ask our patients to do in between sessions. And uh, let me tell you kind of how we got here, but maybe just before that, um, the um, the Feeling Good Institute, which I with a number of friends have started a few years back, about 10 years ago. What we do is we train and certify clinicians in Team CBT, the approach to therapy that we learned from the wonderful Dr. David Burns. And first we started with a certification program to provide a roadmap to how to advance in this approach. And then we created trainings to kind of go through this certification and enhance their skills. And a few years ago, we started to get kind of assemble a team together that are well versed in this approach to making therapy more effective, and kind of created a clinic out of it. And what's special about this clinic is that we want to kind of look at it as kind of like like an elite athlete would look at getting into a team. And so you get pretty good, you get into the team, and now once you're on this kind of high team of high skilled team, how do you continue and improve from there? And as I was kind of grappling with that a few years ago, as we were kind of setting this up, I was wondering what makes therapists better? And as I was kind of doing the research on how to make therapists better and continuously better, continue to improve, kind of was horrified a little bit to realize that we don't get better with time. We get more comfortable in our therapy rooms with time, but we don't necessarily get more effective. And I kind of took a look at myself, and I kind of realized that I wasn't getting better either. I think I was actually a less effective therapist as compared to maybe just a year or two after I graduated my residency program. So I kind of took into reading and kind of dove pretty deep into the literature and to understand what actually are some of the key factors that make therapists better. And as I was doing this, and was excited to find out some clues, was just by chance approached at the same time by Tony Romanier and Alex Vash, who are leaders in the field of deliberate practice of therapy skills, kind of looking at therapy skills as a way to, or looking at therapy skills the same as musicians look at playing better, same as athletes look at getting better. And they suggested, why don't we write a book together about the deliberate practice of Team CBT? And so together with Mike Christensen, who heads our program over in Canada, we started working together and creating this book, and we're super excited of how it's kind of taking shape. We're kind of buttoning it up right now and expect for it to be out towards the end part of 2023. And as I was working in this book together with Mike, we were trying to think, what are some key things that make therapy better, make for better therapists that aren't normally taught in our schools, by our supervisors, and as we train and become therapists. And one of those things was homework. Now, homework is such a key part of what always Dr. Burns, who's our teacher, says about like making therapy better. And we hold our patients accountable to doing homework. But we come to realize that we haven't really gotten a lot of training in that. And so what I'd like to do is launch right now a poll and ask you guys this kind of question. And I'm going to give maybe like 30 seconds, not super long, for you to answer the poll about whether you think therapy homework is actually important for better outcomes. I'm just going to give people a chance to answer here. Maybe like 8 more seconds. And sharing the results here. And so it looks like the vast majority of people, I'd say, it looks like about 92% of folks think that it's at least moderately, if not very much important homework is. And so it makes sense that, we're all in the same boat. We all kind of agree that the therapy homework is actually a very important, or at least moderately important, part of therapy. And so given that, and that actually is very well kind of accepted in the field, right? So Beck, in his book, of one of the seminal books about the cognitive treatment of depression, kind of mentions how it's an integral part, not just adjunctive to therapy. And then in a work by Schmidt from 2018, who created a list of the core competencies of CBT therapy. And Schmidt is also from the Beck Institute, assigning homework and doing homework well, or using homework well with therapy, considered one of the 11 core competencies of a therapist, according to his work. And we have our own Dr. Burns, who over 20 years ago already kind of answered the question of whether it's homework, doing homework, or compliance with homework, engagement with homework, is it a predictor of improvement of symptoms, or is it just a kind of a result of improvement of symptoms? And David Burns was able to show that it's actually a predictor of better outcomes. So if your patient engages in homework, they're more likely to get better faster, rather than it's because they got better that they're engaging more in homework. So clearly it's important. We all kind of recognize that. And so I want to launch a quick second poll here as to your experience with homework training. So how many hours of homework training did you actually get, like formal training that people kind of taught you as part of your career in getting to do better homework, given that it's clearly so important? Everybody kind of recognizes that. Most of us do. So I'm just going to give you, again, like just 30 seconds to give us a sense if you're all kind of similar to the amount of training that I received, which is not very much at all. I'm just going to give maybe like 10 more seconds here as you're kind of thinking about that. All right, so I'm going to show you the results. And so we see here this kind of the inverse relationship between how important it is, but how many training we actually all tend to receive in this. And so we've had whopping 30% of people, more than 30% of people, who receive no training at all in one of the core competencies of therapy. And then about an hour is another 30%. So only just 7% received what would be an adequate amount, maybe, of many hours of training, kind of that would be reasonable to get, given how important it is. Clearly an important topic that we don't get enough training in. This is what we're going to talk about today. We're going to talk about these keys to how to improve homework compliance. And this is based on me basically diving into the literature and understanding what we know from out there, and then adding to it some of my own personal experience. So we're going to talk about every one of these 6 keys, reviewing the previous task, devoting time and how to kind of make it work within the session, making the process collaborative and how to do that. What do we mean by that? how to make therapy homework clear and simple as a key to to increasing the engagement, how to make it easy, and what do we mean by that? And finally, we'll talk about some accountability steps that can also help in compliance. So this is the last poll. And the last poll is going to ask you, which do you think is more important? Reviewing previous sessions homework or assigning this session's homework? Kind of a, I'm just gonna, looks like it's overwhelmingly in one direction here. I'm going to share it with you in maybe just 5 more seconds because you're getting really good at answering these polls really quickly. So 92% of folks believe that reviewing previous sessions homework is more important than assigning this session's homework. And I'm really glad that I gave you this poll because that's exactly what I thought, and it's actually not true. So what we learned from a study done by Conklin in 2018, who reviewed a number of factors related to better engagement in homework. And they found that reviewing previous sessions homework is not as important as you'd think. And their conclusion is, yeah, review previous sessions homework, check in on it, but don't spend too much time on it. Spend time on assigning next session's homework. That's going to be a time better spent and is more likely to yield more engagement in the future homework. My understanding from that, the way I kind of get to it is like, you want to not leave it hanging and kind of unacknowledged, but you don't want to dive in and really understand why things didn't work out the way that you had hoped, not spend too much time on it, but actually spend time just checking in on it so it's not ignored and moving on to the next session's homework kind of based on that and other factors through the homework. And I'm glad I'm not the only one who thought that that was actually not the case, that you needed to spend a lot more time on it. So now let's talk about how to assign therapy homework well. And one key part is you want it to be a collaborative process. So it's not top down. Like you want to ask questions like, what would be a good way to move forward on this? What would be a good action plan? What do you think about focusing on this for homework? What would be a good way for you or good things for you to do before our next session? And just asking that kind of collaborative approach can yield already to a more engagement in therapy homework. You want to also explain the rationale for the specific homework. You want to have the buy-in. And so you'll want to be able to have the buy-in from the patient, and that the goal or the way to get buy-in is by making it a collaborative process, and also by having them understand why is that important, have them feel that it is important. You also want to provide a thorough description of the homework that's assigned, that you make sure that they understand exactly what's needed from them. I know that for me, if I don't know exactly what I'm supposed to do, that decreases the likelihood of me doing it tremendously. And I think that's true for everyone. So we don't want to just say like a verbal agreement is enough. We want to practice together. So ideally, when you give a homework assignments, you figure out a homework assignment for your patient, you want to actually practice some of it together in the session. Let me give you some examples. So if I'm working with my patient and we're working on social anxiety and they're struggling with a lot of shyness, and maybe their homework is to go, you know, around town or downtown or in a coffee shop and just smile and say hello to some people, catching people's eyes and saying hello. It's usually one of the first kind of exposure exercises that we do for social anxiety. I would want them to practice this first in the therapy room, just to catch my eyes and smile and say hi. Another example is if you're working on some negative thoughts and you want them to respond to their negative thoughts, take one of the negative thoughts, respond to it in session, have it in writing so they get a grasp, and then ask them to do the rest of the negative thoughts on their own. If your homework is just to do journaling, practice the first entry right there in the session. So giving them kind of a couple of punches in the punch card so they can kind of feel, okay, they got this, we're going to be able to move forward. And the last point about how to assign homework to make it more likely to be engaged and effective is you want to think together about some obstacles to success. You want to ask, what would get in the way of you actually completing this? Bring into conscious awareness that there will be problems with it. Let's try to figure those out. Lastly, write it down. Ask them to write it down. What I a lot of times do nowadays is I actually share a document with my patients and online, and then we write it down. They write it down on the document on the top of it, the electronic document, and they kind of follow up there. So they know for sure. I know I was a terrible homework completer myself all throughout my schooling. And I think a big part of it is because I have a little bit of ADHD and I would not write things down. I would think to myself, I'm sure I'll just remember this. No problem. I know exactly what the teacher's asking me to do. And then of course it just goes poof out of my head and I just don't remember it. So my brain lies to me and says, you'll remember it, but I don't. Every time, again and again. And I think this is another reason why we want to make sure that we write it down. We ask our patients to write it down. We're not assuming that they'll remember it. All right, so now let's think about the content of the homework itself. Like, what is it that we're assigning? How can we help our patients become more likely of actually completing the homework once it was assigned? You want to think about doing assigning homework that flows into their lives. So they don't need to set aside some special time that takes them out of their routine, out of their lives in order to do it. Ideally, at least some of your homework, as much of it as possible, make it such that is just flows into their lives seamlessly. An example of that is for me when I was training with Dr. Burns, and he was teaching us how to learn how to do the 5 secrets of effective communication, our approach to empathy training. And that's something that we also teach our patients to do to improve their relationships and communication. So David suggested that take a couple of days for each one of those techniques, and whenever we are in communication with people in our lives between now and the next time that we meet, we just use this one technique to start with. And so I was training in empathy, and the first technique that I was asked to, that I decided to practice was thought empathy. This is when you just repeat what the other person is saying verbatim. Don't add to it, you don't change to it. So I come home and after my day, and I remember my wife was preparing, after her day, she was preparing the dinner, finishing up the dinner for our kids. And I was asking her how her day was. And she said, oh, it was good. Like I'm excited. I might get to be with my friend Patty in the same room next semester, next year. And I said, oh, that's great. You're thinking you might get to be with Patty next year. And she said, yeah. And I'm feeling a little torn because I'm not sure if I should be with Patty or maybe I should be with Pam. And I was like, oh, you're not sure. You're not sure whether maybe you should be with Patty or with Pam. And she said, yeah. And so that, exactly. And that went on like that for a little while. And then eventually she was like, are you doing some psychotherapy kind of practice on me? And I said, yeah. I thought you'd be onto it a lot sooner. And she said, please continue. This is really nice. And so the point is of the story is that just make it flow into the patient's life. It makes the whole thing a lot easier. And you can think about it in other things, like if it is like things that typically take setting aside some time, like reading assignments that we often like to our patients to do, then see if you can kind of plan to make it when they read anyway, or if it's something that's more like self-care of their bodies and running, maybe they can kind of, you can figure out together, when can they seamlessly fit it into their day? How can they make it easiest to actually kind of follow through and might not make it a big disruption in their day? So let's think about, I want to make sure, yeah. So let's think about time. So how to manage time as it comes to homework. This is a big part of therapy. If we look at therapy as like a workflow, we start to think about how to manage our time in that 15 minutes that we typically have, or however long we have with our patients each time. You want to think about the workflow and how to weave in therapy homework. If typically what we do is in the first few minutes of the session, we're going to find out how the patient is doing. We check for symptoms, for mood. We do a mood survey before each session. So we review the mood symptoms, we check in with the patient, and then we take that the minute or two, like Conklin suggested, of reviewing previous sessions homework. So how are you doing? We're gonna connect on that first, kind of empathy and connection, and then how did it go with your homework assignments? And then we're going to move on from that pretty quickly. And we're going to have our bulk of our hour. And what I'm recommending is throughout that hour, if something comes up that you're thinking could be a good homework, continue to kind of collaboratively use that time to figure out your other homework assignment. But then a moment 40 or 10 minutes before the end of the session, you want to start, you want to have an internal clock, or you want to start to feel uncomfortable saying like, okay, we haven't figured out our clear homework yet. Let's review the action plan. So start moment 40 or so is when you want to start to have that kind of statement. Let's review the action plan together. What are we doing? And then that'll give you enough time to maybe start on doing some of the kind of the initial plan of the homework assignments, like I suggested, to practice first in the session and then without you in between sessions. I'm going to go just a little bit further deep into what to assign. Some of you are not familiar with Team CBT, and I think there's still some of it. I'm going to go pretty briefly about it. I think there's still something in it for you guys who are not familiar with Team CBT. But very briefly, I want you to, I'll give a quick synopsis of what is kind of Team CBT to this way of thinking. It's basically a process. It's a process of workflow of how to do therapy in a way that makes it more effective. And it basically gives therapists a roadmap into how to conduct therapy based on it. And if you look here in this schematic representation, T is for testing. So we check symptoms before each session, then we do our stuff in session, and then we test again. And then the patients will do homework, and then we'll come again to the next session. We'll see their symptoms again. We'll do our magic together, check how helpful it was, assign homework. So that's the flow of things. And what we do within session is also pretty clear. Like there is a pretty clear step-by-step process to what we do. And what we want to do is assign homework that also kind of moves us along the process of therapy. And that's what I wanted to kind of share with you. So for us, we divide homework into kind of two kinds. One is more of a lifestyle well-being type of homework. And there's some thought and some data behind this kind of approach, because the thinking is that what makes all therapies, all kinds of schools of therapy, one thought is what makes all of them kind of effective in a similar degree if done well, is that they all kind of converge into the patient being able to do some of those wellness things that would make anyone feel better, whether it's their sleep and wake cycle, whether it's to do more exercise or meditation. And so one of the benefits of therapy is being able to kind of motivate, encourage, or have the patient be able to kind of start doing some of those more like lifestyle or well-being, wellness type of activities. And these are typically behavioral, and they go across the board. They don't have to be in a particular process in the therapy to start paying attention to that. And that's one kind of therapy homework that we assign. And then the other kind of therapy homework that we assign is more that one that more kind of moves the therapy process itself forward. And that's typically more cognitive in nature. And so I'll give you some examples of what we do, because I know a lot of you are probably a little bit familiar with Team CBT. So in Team CBT, we divide the steps roughly into these kind of places in therapy or steps in therapy where you see here in the left column, which is start with testing and lots of empathy. Of course, we always empathize with our patients, even in other steps of therapy. And then the next kind of shift in the process is when we ask for what we call an invitation. So we invite our patient to work on something towards their goals. And after that, when we figure out what we're working on, we're going to start to think about what would be some good reasons actually not to achieve those goals, and bring the resistance to change to conscious awareness before we're melted away. And then the next step would be figuring out whether the patient is going to be willing and able to to do the work that is required in order to overcome the problems. And finally, we're in kind of the methods phase. So if in this process of therapy, we're still kind of in the empathy phase, we don't really know exactly where the patient wants to go and what are the goals of therapy, then the kinds of homework assignments that we would give would be ones that push us towards that. So we would ask the patient to maybe journal, maybe think about their goals for therapy and write them down. Maybe we'll do a bunch of other kind of ask them to do some work that helps them understand what their role in therapy would be in order to make it more successful. And these would be the kind of assignments. These would be different if we already know what we're working on, but we're not really specific. So if there's like the invitation is like, yes, I do want to work on some problem, but we don't know enough about the problem. And then so we'd want our patients to maybe capture moments in time when they were, if this is depression, maybe that they were feeling more depressed or down. And let's start to understand the anatomy of the feelings and thoughts and their sensations when they're feeling down. So this will kind of serve us for the next therapy session to be able to get this data and start working on it. And then if we're kind of moving along, we would, again, try to give homework assignments that move the therapy forward. I'm going to just leave it at that here. This is a little bit of a taste for you of what kind of how to look at specific homework assignment with Team CBT. When I was giving this similar workshop to our team of therapists a couple months ago, we went more and we practiced some of this because it was more relevant to them. And if this kind of stuff interests you, then you're welcome to take some of our trainings and kind of learn more about it. And the last part that I want to share with you is some tips about how to create better engagement with therapy homework is thinking about accountability steps. And anything that builds accountability could be helpful. And to some degree, maybe just checking previous sessions homework is a form of accountability. But also ask the patient, is there someone that you'd want to share that this is your plan with, and so they would kind of commit to them as a kind of accountability buddy. Maybe I'm certainly happy to always offer my patients to send me a text or an email telling me that they were able to do their homework, just to kind of help them with their own accountability in between sessions. One language, kind of one way of saying this in a way that I think is pretty cool is to use this mission accomplished versus stubbornly refused language. So this is very deliberate. This is based on David Burns's kind of work. He came up with this language, but the idea is that if they complete the homework, the patient sends us just 2 words, mission accomplished. But if they did not complete the homework, they send the other words, I stubbornly refused. And so the idea there is to keep the patient really accountable, believing in them. They can totally do the homework. You really believe in them that they can do this. And it was their choice for whatever reason not to do it. This could be another way of kind of holding folks accountable that you can think of. Some people don't like the idea of stubbornly refused because it feels a little kind of hardlined. And I can totally understand that as well. So it's not for everyone. And finally, if you really want to do like a big negative accountability step, you can do it with some negative consequences if they don't do it. Like if they don't go on their run, they wash the dishes for the rest of the day. Or if they don't wake up on time, they do some other chore that they don't want to. So we can kind of think of different negative consequences if they don't actually complete the homework. And that can be a lot of fun to think about, like kind of good, helpful, negative consequences that don't really harm anyone other than deter you from not doing your homework. So now let's go to you guys. So I want to ask you if you can take a moment to think about maybe one step that you can change, you can kind of concentrate on in the coming weeks about what would be your action plan. And let's review what we've learned and think about what would be your action plan that you would want to take forward from here. The first is to remember to not forget to review your previous session's homework. But to still review it and briefly. So review it briefly. That's one thing. That's the first step that I took when I kind of got to realize that I'm not so great in therapy homework. The second that I would suggest is to think about assigning homework that flows into the patient's routine, to think about assigning homework that flows into their routine without it being too hard. And the next one is to practice in session, to make sure they write it down, assign homework throughout the session, plus the last 10 minutes, or use accountability steps. So maybe I can ask you to put in the chat box, what would you suggest? What would you commit to as your action plan? I'll give you a couple minutes. Very cool. So I see that a lot of you have put in their plan. Thank you for that. I wonder why my screen is showing these. Jill, maybe you know why. I don't think I.
Well, first of all, Maor, you should probably read. So remember that the chat only went to you and I, so no one saw anyone else's responses, right? So what I would do is make sure that you're sharing with everyone what people are sharing. And I have no idea who is writing on your screen or how that could possibly be happening.
Right.
It's definitely not me, but I see what you're talking about. And I just don't know what that could be.
Looks like someone is realizing this, and thank you for erasing it. I'm sure it's
I can't
unintentional.
Yeah. Anyway.
All right.
Yeah,
So good idea. So
yeah.
I'm going to go back to the chat box and read some of the things that people are committing to. So Piper is mentioning considering practicing journaling during session and want to start doing that. And a few are saying, how about we plan to practice the homework assignment in session. I love that. I think that is wonderful. The key to that, by the way, is to devote enough time. So if in order for you to be able to do that, to practice in session, you're going to have that discomfort come up at minute 40, 10 minutes before the end. So you really have the time to practice it a little bit before you actually run out of time. And that's going to be a key part. I know that there's like this gravitational pull to always kind of continue to engage in the session, and then you're kind of wanting to really be respectful of the patient and might be going through something and might be sharing with you or whatnot. But the idea is that you want to be able to devote the time that you need in order to get to the practice. Others are mentioning flowing into their routine. You want to be kind of make that part of the collaborative process of how to make it flow into the routine. You want to think with them, how can we make it flow into your life without being too disruptive? You want to think about it creatively and kind of try to solve that problem of how to make it not too disruptive. Others are suggesting the accountability steps. Yeah, the accountability steps are really, they could be a lot of fun as well. When using accountability steps, there's a lot of room for accountability steps in therapy, not only for homework, but for any kind of things or changing of habits. And we use a lot of accountability steps in our work when we work with people to change their habits towards better habits. Let me see, there's more that I'd like to share here. So I think that catches a little bit of what people are saying. I want to just mention to you a little bit about Feeling Good Institute. So what we have is we have this core group of therapists who practice in this approach of continuously improving, continuously getting better. And if you want to refer patients to us through this group, it's very simple. We want to make it very simple for people to refer to us. And so you can ask your patients or whoever wants to see a patient through a program is to just go on our website and click on book a free consult. We want to make it very simple. This will get them to consult, to set a time to meet with a clinician, always with a clinician, not with an admin, who can help guide them towards, if it's not themselves, towards a better, the best fit for them. I think with that, I actually kind of got through the material a little bit faster than I expected. So this allows for us to have a few minutes for questions. So maybe if anybody has some questions in the chat box, happy to answer those right now. Put them in there. I'm going to try to answer them the best I can.
I'm happy to facilitate for you as well, or so if anyone has any questions / comments that you want to make about assigning homework to your patients, enter them in the chat box, and then Maor can see them, I can see them, and we'll make sure to get them answered.
Great, and I see Anandi Gray asked about what books do we recommend at the beginning of therapy, and that's a great question. It depends on the diagnosis. It depends on what the patient is coming in for. If it's problems that are typical for depression, my number one go-to is going to be the Feeling Good Handbook by David Burns, and I asked them to. It's a handbook, so I asked them to see if they get willing to spend 20 or 30 minutes every day on the book. And what I asked them to do is to actually not read as much as they can, but actually to do all the assignments and all of the kind of exercises that the book is asking them to do. And that approach to reading assignments is true for whatever book I recommend. If the patient is coming with problems with relationships, then a great book that I now recommend is Hold Me Tight. That's usually when I'm seeing couples, and I recommend Hold Me Tight, the Hold Me Tight workbook. And that's another one that they would rather them spend some time doing together. For folks coming in with anxiety, probably, other than depression, is probably the #1 problem that we deal with. There I'm kind of torn. Usually I go with the book, it's called Dare. Can't remember the name of the writer on this one, but it has a great way of explaining to patients that in order for them to overcome their anxiety, they're going to have to dare to face it and work against their avoidance and kind of not be afraid of their anxiety. Jill, do you have a book that you recommend?
You know what, Maura, I was just answering some other people's questions in the chat box and I lost track of what you just recommended, so I don't want to repeat you.
Book recommendations at the beginning of therapy.
I love the book, David Burns' book, When Panic Attacks. I actually think that's my favorite book for how he lays out specific CBT techniques. I think it's very user-friendly.
Yeah. So Jill likes When Panic Attacks best. For anxiety, I like the book Dare best for anxiety. Both are wonderful, and my patients often end up reading both.
And Maura, I'm not sure if you can see, but I see a bunch of questions. Do you want me to read to you? Yeah. So let's see. One question is, how do you adjust for working with kids, young children, and teens? I guess, homework assignments for kids and teens.
I'm not the best authority to answer that. I typically don't work a lot with teens. The one rule I have that seems to be helpful to work with teens is that I want to slow things down a little bit as far as like really making sure that they feel safe with me, that it's not going to be as easy for them necessarily to feel safe with me and comfortable with me. So I usually kind of don't push the pedal to the metal right off the bat with a lot of assignments, but wait till we have a really good buy-in and connection. And other than that, once I do that, then it's going to be pretty similar to what I ask from adults, and probably a little bit more behavioral in nature. Like it's a little bit more about like their schedule, their routine, and their sleep and wake cycle, and their exercise and their meditation. That kind of stuff will kind of come in first before any kind of things that are a little bit more touchy and vulnerable.
Great. So yeah, one question which maybe stems from that one is, do you find clients are more responsive to behavioral lifestyle kinds of homework assignments or cognitive therapy process assignments?
Early on, because early on they're just learning that's a really, really good question. Let me answer it slowly because I think there's a lot in there. So what part of the research that I found was to say that it's not just in general that homework is a predictor of good outcomes, but it's particularly the first few sessions of homework engagement that are predictive of it. And so we want to start well with a lot of engagement. And when we start therapy, we don't have a lot of content cognitively that we've kind of gone through in order to actually make for a lot of homework. A lot of times we're kind of not quite ready after the first and second sessions to have a lot of kind of cognitive related homework. So usually the way it starts is a little bit of a heavier emphasis on behavioral wellness type homework. And then as the therapy progresses, in the third, fourth sessions, maybe even the second, we can be a little bit more cognitive because it does need a little bit more education and kind of training on our part of our patients to what to do for homework and how to approach. There's a kind of a skill set that we're teaching them when we're doing cognitive work. It's a great question.
Also, I guess one more thing about the kid question. Jessica Drobny, who's a CBT enthusiast, added the book Anxiety Relief for Kids, on-the-spot strategies to help your children overcome worry, panic, and avoidance. So that was her book recommendation, Anxiety Relief for Kids. And that was good because another person asked any more recommendations for reading materials for kids. So thanks, Jessica. Someone else added that with kids, sometimes there's an aversion to using the word homework. And so you might call it practice, that kind of thing, which is true. And the only thing I would say is that, you know, knowing lots of people who work with kids and teens, there's still between session work, right? Even if you have to make it more behavioral or water it down a bit or make it take a little bit less time, the bottom line is still that patients, whether they're kids or teens or adults, need to actually be implementing things in between sessions in order to get better. And that applies to kids too.
Right. And someone here mentions that Jacob Towery, my good friend Jacob Towery, has a great book for overcoming depression for teens and young adults, and suggests a lot of has a great approach to how to do that. Although a lot of people recommend that. I definitely recommend that for my younger crowd struggling with depression as a way as well.
Or someone asked, can you give a few examples of accountability steps for changing habits?
Yeah, so let's say, I'll give an example. So I was working with a person who had has a problem, has been diagnosed with alcohol use disorder, and has done great work, was able to kind of, it needed to go to a program for a few weeks, and then was able to stop drinking, and then noticed that after a few months of being sober, he's noticing that he's kind of drinking here and there. And so in the session, part of his homework was to get rid again of all the alcohol in the house. And so the accountability step was to send me a text with the drained bottles in the sink of what he had in the house, and we kind of celebrate it. So one accountability is that, just to kind of follow up with some way, especially if it can be fun, can be celebratory, of accomplishing a task. That's probably the most common accountability step that we take. Sometimes another one is to, if you have some homework that we've done every day, is we can have a system where they send at a certain time. Let's say the homework is to wake up before 9 o'clock every morning. And so maybe the accountability step would be to send me an email every morning at 9. And that email has to be sent from outside the room. That could be kind of another accountability step that really pushes people to do it in a way that is kind of indicative of completing the homework. And coming up with this accountability step is something that's collaborative. So if, you know, I'm thinking with my patient, okay, so how about we figure out would it be helpful if we keep you accountable in some way? Could you send me an email every morning at 9? And then he said, well, I'll probably be sending it from bed. So I don't know that that's going to be helpful. I'll probably go back to sleep. And then our thought was, so how about if we keep your phone, you email me from your phone, and we keep your phone in the bathroom. And the rule is that you start the water running, and then you write me that you woke up, or something like that. So we work on it in a collaborative way to kind of figure out the accountability step. A more kind of like punishing accountability step could be having negative consequences, and that again could be related to something that should be something pretty innocuous, but that the person really doesn't like. So they can kind of pick their least favorite charity to donate to. So if someone is so some ideas that I've had in the past was someone would give to charity their least favorite person for Senate. For them, it was Ted Cruz. So they're like, Ted Cruz for Senate. They donated $20 to that if they didn't do a certain accountability. So we can kind of think creatively about some ways to make people uncomfortable with not doing the homework, and kind of think about that together, collaboratively, how to move forward.
And of course, as someone points out quickly, of course, that might feel punitive and lead to feelings of shame and low self-worth and less productivity. And so I would say, of course, we can also help patients to think through what are ways they might want to reward themselves for doing their homework. The homework itself might be rewarding, but also sometimes patients do want to set up, reward systems for themselves as well. There was another question that has to do with motivation, or there were several questions that had to do with motivation and homework. So the question there is something along the lines of, what if someone doesn't want to do homework? So what if someone flat out says, I won't do homework? How do you deal with resistance to doing homework?
Yeah, that's a great question that deserves probably a day of a workshop. But just to make sure that this is less likely to happen, one of the first things I talk about when I first engage with a patient is talk about the kind of approach to therapy. And I say to folks that it's not for everyone. So this is, that usually patients start with us with a 15-minute phone conversations with a clinician, and they kind of want to learn about what it's like to do therapy. If they ask what it's going to be like to do therapy with me, or even if they don't ask, I want to check with them. So I make sure to check with them, tell them, hey, this kind of therapy, the approach that we have is not necessarily for everyone. I believe that in order for you to get better faster, I want to be really effective to you is what I say. And in order for me to help you get better faster, you're going to be expected to do therapy homework. And how would that feel? Would you be open to doing therapy homework? And how much homework would you be willing to do just to get better faster? And so we review it really at the beginning. If someone says flat out, I won't do any homework, I typically would want to spend some time on that, understand exactly why. What are the reasons that they wouldn't do homework? A lot of times it could be that they're just feeling so unmotivated. And so then to me, that would mean that they're probably feeling pretty hopeless. And then I would know to focus my therapy session with them on hopelessness, and then collaboratively with them assign hopelessness related therapy homework. And so the idea is that I don't want to get head to head with people and butt heads with them, but I want to understand while keeping my kind of my eyes on the ball with like the plan is to go and be in a place where we're doing homework. Otherwise, I'm going to be a lot less effective. For some reason, when resistance comes up, we want to kind of deal with it.
I would add, I'll add one more thing to what you said, Maor, just for extra color here is, so when I talk to people actually at the phone screen level, so homework is so integral to the work that we do, and we feel like it's so important for good outcomes in therapy that when I talk to people at the phone screen level, so my first contact with patients and I'm explaining about the kind of work that I do, I say that I think of it sort of like you might think of personal training, but it's like personal training for your mind. So if you went to see a personal trainer and they worked you out really hard for 1 hour once a week, and then you did no exercise between sessions, you really wouldn't expect yourself to get any fitter, right? It probably wouldn't work very well. And I think the same exact about therapy. So I say to people, like, if you'd like to work with me, the kind of therapy that I do really depends on doing work in between sessions, and I really want to get you better and get you better faster. And if that doesn't sound like a good fit for you, right, if you really don't want to have to do homework between sessions, I totally understand and respect that. But then I'm probably not, the best therapist for you. And that way patients feel like they're really consenting to a homework driven therapy, and they're kind of also feel like the bar is high, the standards are high, they're going to get better, but they're going to have to actually do the work between sessions. And people usually really get it with that kind of personal training metaphor, because they know that if they, wanted to get fitter and didn't do anything about it, they're not going to get fitter. And the same goes for therapy.
Thank you, Jill. Yeah, I see that there's a lot of folks kind of wondering about what to do when there's resistance to homework.
Yeah.
And this is totally expected. It's not going to be surprising to anyone. By the way, one way to people kind of commented, it's not a great name, homework, and maybe for teens, it's not great for anyone. So oftentimes you want to call it action plan. What's our action plan? What are our action items? Rather than homework. But for those of you familiar with Team CBT, you've heard of process resistance, and homework is part of process resistance. Process resistance is anything that has to do with the work necessary in order to recover. And so when we always know that there's work necessary in order to get better. Not doing anything is always going to be easier. And we need to address the challenges that come with the willingness the willingness to do the work necessary in order to recover. And part of it could be homework. And there's really a lot of techniques that we use, and we teach. They do need a bit of time to train. But for those of you who are interested in this kind of training that we do, we address this approach by in our approach. We address this problem of process resistance very deliberately. We kind of expect it to be there. And one way of doing it, someone asked, but so what do you do with hopelessness? Well, usually we start with creating a table, a cost-benefit analysis with the advantages and the disadvantages of feeling hopeless. And that usually kind of really jerks people's minds, like, what? Advantages of hopelessness? What do you mean by that? And then I can think of a bunch of disadvantages, but not so much it feels terrible. I'm stuck, but what are the advantages? And so the way to start working on hopelessness, and that kind of part of it's a form of process resistance, is what are the advantages of what are the advantages of feeling hopeless? And there are many advantages of feeling hopeless. If we didn't feel hopeless in our lives, that would be a problem, because we would not know to turn our energy to something else. There are advantages to not doing homework as well. It's easier. You don't have to work so hard. You can do other things that are more enjoyable. There's a lot of advantages to not doing homework, and we need to first write them down and then bring them to conscious awareness. We can then kind of deal with them and melt them away. So I think that's probably the time that we have. And so I'm kind of want to remind you that to complete the CE survey at the end of this, and so you'll get your CE certificate. I want to also remind you to take a look at what remind yourselves about what you're planning to do, what you learned from today, of the things to help engage with better homework with your patients, and focus on that in the coming weeks as your plan, and how to start to get better at assigning and better homework engagement with your patients. I want to thank you for being here, spending the time with me. It's been a pleasure. And if you have any questions for me, if something comes up for you, I'm always happy to hear from you. My email is maor@feelinggoodinstitute.com.
Okay, well, thanks everyone for joining us today. I'm going to stop the recording.
Thank you, Jill.